Tourette syndrome is a neuropsychiatric condition that on the neurology side involve motor and vocal tics that can interest a different part of regions of the body and can show change of patterns of pattern over life.
People with Tourette's would also sometimes can present with some psychiatric comorbidities. Now, many a times these people struggle with the stigma around the tics and the motor symptoms. When they get into a crowd, people notice them having the tics, and that actually makes them stressed and causes many of these psychiatric symptoms which we talk about.
Yes, so on the motor side is treatable in different way. When there are mild motor and vocal tics, we can treat with habit reversal therapy or cognitive behavioral therapy. In the more severe situation, when the people feeling the social pressure, then we can start a pharmacological treatment.
The primary chemical that we tend to aim for is dopamine, because what we understand from the depth of research that we have, that dopamine seems to be the most prominent responsible chemical. So most of the medication tend to work on reducing that dopamine. So frequently the medications that we use are something that I tend to use in other aspects of my psychiatry practice as well. So you would see some frequently common names and overlapping names as well. And from research, we know that these medications work. From our own clinical practice, we know that people who are started even on a low dose start responding and showing a reduction in their tics. I think the first line of approach should be, can we look at environmental factors? Could we look at social factors? Could we look at psychological factors? We use the word biopsychosocial model. The biological part is the medication which we as doctors prescribe, but the psychological part and the social part is also very key in recovery from this condition. So psychotherapy, particularly named as habit reversal therapy, is very important in these group of people. The simple mechanism there is to recognize the tics, but most important, ability to suppress it as long as you can. The third part of it is the habit reversal, where you replace some of those tics with some which are less noticeable. That is the basic key to habit reversal.
It is also important to highlight that the stigma is also on taking medication. So sometimes we start with the step one that Dr. Costa mentioned, but doesn't work by itself and we need to add the medication. Sometimes there is a resistance from the patients to accept taking medication that are in the group of the antipsychotics to treat the tics, the movements that, as Dr. Costa explained, have the same neurobiochemical base. So we try to help in our service also to explain to the patients that we need to address the best therapeutic pathway for each one.
There are not many joint services in the country, so not one we know, at least in the Northwest. So frequently patients with tics would either go to GP, pediatrician, neurologist or psychiatrist. Now, having two experts in the same room helps us first of all in the assessment. So the assessment will cover the entire bulk of neurology, but also check on all the aspects about their social as well as psychological aspects of the impact of the disorder. But most important, then think about the plan of management. And having both of them together we usually get around 40 minutes in that entire process, has been very useful when the patient comes and visits us. So it's a one-stop shop which delivers you the service that is needed for these young people.
Being together, we can treat as many as possible symptoms with the lesser number of therapies, because with the consultation between us, we can choose, for example, one treatment that can address the motor and vocal tics and the psychiatric comorbidities, or decide that they are both aside very mild and we go for habit reversal therapies.
The other thing I want to add is the complexity of cases that we then find, and we are able to work together to treat. So beyond medication, if there are other options that are available, then we can invite further experts as well. And working together, we have been able to improve our understanding and gain resources across the country as well to this place. So that's another advantage of working in a joint clinic.